Hi, welcome to Global Sources Online Show. My name is Araceli Camargo, and I am going to be doing a talk on healthcare as a system. So first, let me start by sharing my screen. Okay, here we go. So I am a neuroscientist and I'm the head scientist at Centric Lab, which is based out of London in the UK. And the focus of our lab is to look at urban health and health justice. So what neuroscience allows us to do is to look at the neurobiological link between us and the habitat, and more specifically, how that relationship can lead to disease and or disease pathologies. So when we're looking at health, we're taking away the conversation from the individual into a systemic view. And some of our tools are for consultancy purposes, and some of our tools are there to be able to instruct citizens so they can start their own health justice movements. So we straddle the two things. So as I said, today we're going to be looking at healthcare as a system. But before that, we got to start with what is health. So our lab has a very distinct definition of what health is. It's the ability for our biological systems to enter stability after experiencing trauma or stress throughout an entire lifetime, to give us all an equal opportunity to realize our full potential. So I'm going to come back to the top part of the definition, but right now I really want to center you on the bottom half, which is the idea that health is about giving people or allowing people to have an equal opportunity to reach their potential, and really anchor health as a cornerstone to everything that has to do with human life, with human society. So this means that we have to look at things from a planetary health perspective, because that plays a big role in human health. We also have to talk about it from a justice perspective, that we have to ask questions: who has health? Who doesn't have health? The people that have poor health outcomes, is there something systemic that is preventing them or leading to those poor health outcomes and those health inequities? And then the next one, which is a big one, is climate adaptation. If we don't start to learn to adapt to climate, we are going to A, increase the diseases that we already have, and B, we're going to create new ones. And that has two strands. It is, yes, a question of pathogens, but it's also a question of things like PTSD and depression and anxiety, because when somebody experiences a natural phenomena that hasn't received the right help or the right structure, that can lead to displacement, it can lead to the loss of community, it can lead to a loss of life, which is traumatic. And that's where things like PTSD or depression, anxiety end up flourishing. So we end up with a new set of people, new populations, new communities in peril, and we put them also in peril to longer term physiological chronic diseases. So going back to the beginning part of the definition in regards to the biological stability. So many of you are probably going to be used to this, as this is a medical conference, but the stress response from our perspective, how we see it is that it's that interaction between us and the built environment, or us and the habitat. And again, here we think about it in two terms. We've got the environment and the experiences that happen within the environment. Our bodies or our stress response reacts to both. And the system of the stress response is mediated mainly by the hypothalamic pituitary adrenal gland. And this is the core of the work that we do and the research that we do. So here is a brief. It's very important to stress that it's obviously not linear, even though I am showing it in a linear format. It's a constant symbiosis. So we have, from a psychological side, our body responds to things like losing a job, economic insecurity, experience of discrimination, and that all goes under the experience of poverty, mainly. And then you have this the physiological stressors. So things like air pollution, noise pollution, light pollution. This is something, again, that we see mainly in impoverished environments, or in impoverished neighborhoods that have higher levels of environmental stressors or environmental toxins. And so what ends up happening is that the stress response engages. It's a very necessary response, and it engages because we need to bring the body back to a form of stability. So the stress response then speaks to our endocrine system, it speaks to our metabolical and immune systems to create the correct responses that our body needs to come back to stability. But what happens if it's constant? What happens if it's chronic exposure? This is something that we've identified and coined as biological inequality. So our formal definition is that it's a person that disproportionately is exposed to chronic environmental and psychosocial stressors, putting them at risk for complex metabolical and mental disorders. So unpacking that a little bit further, as I already explained, the environmental stressors come from pollutants, and then the psychosocial stressors mainly come from that experience of poverty. Both, again, causing the stress response to engage, but that chronic engagement has to have a price. There's a wear and tear that happens in our body, and that is called allostatic load. And allostatic load is now probably one of the newest forms of study to understand disease pathology, to understand disease and disease evolution. And what's really interesting for our side in being able to talk about metabolic or mental disorders is that these disorders are growing across every habitat, i.e. urban and rural. And they're going to continue to grow if we don't do, or we don't look at things like justice and planetary health and climate change adaptation. So when, again, we're thinking about health, yes, it is great to focus on disease because we do need cures, but we also have to see health way above and beyond than the absence of disease. This is something that has happened in the conversation about COVID, that at least in the UK and the US, people said, it was people that had chronic disorders that were deemed as being unhealthy and thus more susceptible to COVID, whilst quote unquote healthy individuals were not susceptible. But if we take our definition of health, perhaps already the people that also got sick were people that had already an excess of stress, an excess of dealing with chronic stress. And therefore they already had levels of deregulation in their system that didn't allow them to be able to combat this virus, making them more susceptible. And that's the final puzzle piece that I want to ensure that we understand in this, is the idea of susceptibility. Because again, in these conversations around COVID, it's been said, or it's been uncovered, sorry, I should say, that Black, and in the terms of the US, Black and Indigenous people have been the worst hit. But it's got nothing to do with being Black or Indigenous. It's got nothing to do with race. What it has to do is the environment. So the environment, when you have an exposure to biological inequality, and you have that wear and tear of the body, your body is more susceptible to disease. But you could interchange anybody in that scenario, and they would end up also with that susceptibility, and also with higher rates of COVID or any other pathogen or injury that comes to that community. Their susceptibility to a disorder or to a disease would be higher because there is already a deregulation in their system. So we're moving now then, what does this mean in terms of healthcare? So if we're going to look at healthcare, we have to look at it as a system. And this is a little bit of humor or brevity, but I am American, as you can hear from my voice, and massive Bernie Sanders fan, and also a huge hip hop fan. And so here's Bernie Sanders speaking to Killer Mike. And they were talking about precisely that, the Black experience in America, and what it is like for Black people to access health. And Bernie very astutely answered that healthcare is having a lifestyle which prevents disease in the first place. And that's really what we have to aim for. But it's not the onus on the individual. We have to go above and beyond just saying, well, if you exercised more, if you ate less of this, or you ate more of that, because at the moment the individual doesn't have the agency. An individual cannot have agency over their health unless it's part of a supportive ecosystem that allows them and provides them with the support so they can then have that agency. And then Bernie goes on to say that, that it has to do with things like nutrition and decent housing. So what he goes on to describe really is a systemic view of healthcare. So we've broken down the things that we really need to now start thinking about health, which is access to green spaces, clean air, clean water, climate adaptation, biodiversity, and nourishing food. Those two things go hand in hand. We are losing our biodiversity, and thus we are losing the ability to even grow and access food that is of high nourishment to us. Access to resources. So for people that live in cities, it's access to healthcare, but it's also access to community. Building community is so important to our health. Access to employment. And then for indigenous people that are living off the land, it's access to their land, access to be able to have that sovereignty to land. And then of course we have access to dignity. I think dignity is a really interesting and very important word when it comes to health, that we need to afford people the dignity to access health, or the dignity for them to be able to have agency over their health. So that is the end of my slides. In terms of you guys and what you should be taking away is being able to understand that whilst, yes, we have to be able to deal with health in terms of the diseases, and we have a long way right now with COVID, and COVID is probably going to lead to copious amounts of industry in terms of health, because people are going to be very aware of needing to heighten their health. We really have to start thinking about health as a system, and all of us that are working within healthcare or within health, we have to become advocates of all the other elements. There's just no way that we're going to reach our goals, our health goals, I should say, if we're not advocating for racial justice, if we're not advocating for economic equity, and if we're not advocating for planetary health. We have to be able to hit all those things in order for us to actually achieve the health outcomes that we want, or at least better health outcomes, so we can build a society that can fulfill their potential. A lot of the times we think of us already being at an apex, and we're not. I think COVID has really highlighted that we're not in any form of civilized apex. And that's in part because we're having to deal with so many mental disorders and so many metabolic disorders and so many disease in general. So we really have a long job ahead of us. But this is partly our job at our lab, and this is also partly your job. So with that, I thank you, and I leave you to the rest of your conference, and I hope you enjoy this. Bye.